The path to repigmentation in non-segmental vitiligo. Vitiligo is a chronic autoimmune condition where the body's immune system mistakenly destroys the cells that give the skin color, causing white patches to appear on the skin. The most common type of vitiligo is non-segmental vitiligo, where these patches show up in matching areas on both sides of the body. While everyone's vitiligo may look different, it all starts with a problem in the immune system. The immune system recognizes and fights off infections with the help of special chemicals called cytokines. In people with vitiligo, the immune system becomes too active and mistakenly recognizes melanocytes, the cells that give the skin pigment or color, as harmful and attacks them. This attack causes inflammation, leading to more immune activity and continued loss of melanocytes. Without melanocytes, skin loses its pigment and white patches appear. This process is called depigmentation. The JAK-STAT pathway, a signaling pathway of cytokines in the immune system, is believed to play a key role in this depigmentation process. The JAK-STAT pathway and cytokines help the immune cells communicate and stay active. In vitiligo, this pathway becomes overactive, causing continued inflammation and damaging more pigment cells. For people who are interested in repigmentation or restoring their skin color, one treatment option is OPZELURA. OPZELURA is the first topical prescription treatment for non-segmental vitiligo repigmentation for adults and children 12 years and older. It is the first treatment for non-segmental vitiligo to address the JAK-STAT pathway. While it is not known if targeting the JAK-STAT pathway leads to repigmentation, it is believed to help reduce inflammation and melanocyte destruction, which may lead to repigmentation over time. Do not start OPZELURA if you have an infection, as it may lower your ability to fight it. Tell your doctor if you have or had an infection, TB, hepatitis B or C, blood clots in legs or lungs, heart attack, stroke, cancer, high cholesterol, smoke, or are pregnant. May cause serious lung infections, certain cancers, immune system problems, blood clots, and low blood cell counts. Major cardiovascular events or death occurred in those 50+ taking oral JAK inhibitors. With inflammation reduced, melanocytes may slowly regenerate and travel from the hair follicles to produce pigment over time. This repigmentation process is complex, takes time, and can happen differently for each person. People living with vitiligo who experience repigmentation might first notice small spots of color around the hair follicles or at the edges of the white or depigmented patches. Areas with more hair follicles, like the face and limbs, tend to respond better than in places like the palms and soles of the feet. The unpredictable progression of vitiligo can leave many people feeling like they don't have control over their condition. Treating vitiligo with a topical cream allows people the flexibility to choose specific areas to potentially repigment. OPZELURA is proven to help restore the skin's color for vitiligo areas on the face over time. In clinical studies, about 1/3 of patients treated with OPZELURA saw 75% improvement to vitiligo areas on the face at 6 months. After 1 year, about half of patients who continued with OPZELURA had 75% improvement to vitiligo areas on the face. After 2 years, about 2/3 of patients who continued OPZELURA had 75% improvement to vitiligo areas on the face. Using OPZELURA as prescribed, twice daily and part of a consistent, regular routine, helps support ongoing progress. Consistency is key. That is why staying on treatment as directed by your dermatologist and tracking progress is important. Learn more about the potential for repigmentation with OPZELURA, including real-life patient stories, at opzelura.com/vitiligo. Indication and usage. OPZELURA is a prescription medicine used on the skin, topical, for the treatment of a type of vitiligo called nonsegmental vitiligo in adults and children 12 years of age and older. The use of OPZELURA along with therapeutic biologics, other JAK inhibitors, or strong immunosuppressants such as azathioprine or cyclosporine is not recommended. Important safety information. OPZELURA is for use on the skin only. Do not use OPZELURA in your eyes, mouth, or vagina. OPZELURA may cause serious side effects, including serious infections. OPZELURA contains ruxolitinib. Ruxolitinib belongs to a class of medicines called Janus kinase, JAK, inhibitors, which are medicines that affect your immune system and can lower your ability to fight infections. Some people have had serious infections while taking JAK inhibitors by mouth, including tuberculosis, TB, and infections caused by bacteria, fungi, or viruses that can spread throughout the body. Some people have been hospitalized or died from these infections. Some people have had serious infections of their lungs while using OPZELURA. Your healthcare provider should watch you closely for signs and symptoms of TB during treatment with OPZELURA. OPZELURA should not be used in people with an active, serious infection, including localized infections. You should not start using OPZELURA if you have any kind of infection, unless your healthcare provider tells you it is okay. You may be at a higher risk of developing shingles, herpes zoster, while using OPZELURA. Increased risk of death due to any reason, all causes, and major cardiovascular events. Increased risk of death and major cardiovascular events, e.g. heart attack or stroke, has happened in people 50 years of age and older, who have at least one heart disease cardiovascular risk factor and are taking JAK inhibitors by mouth, especially current or past smokers. Cancer and immune system problems. OPZELURA may increase your risk of certain cancers by changing the way your immune system works. People taking JAK inhibitors by mouth have reported lymphoma and other cancers and are at higher risk of certain cancers including lymphoma and lung cancer, especially if they have ever smoked. Some people have had skin cancers while using OPZELURA. Your healthcare provider will regularly check your skin during your treatment. Limit the amount of time you spend in the sun, wear protective clothing, and use a broad-spectrum sunscreen. Blood clots. Blood clots in the veins of your legs, deep vein thrombosis, DVT, or lungs, pulmonary embolism, PE, can happen in some people taking OPZELURA. This may be life-threatening. DVT and PE have happened more often in people taking JAK inhibitors by mouth who are 50 years of age and older, and with at least one heart disease cardiovascular risk factor. Low blood cell counts. OPZELURA may cause low platelet counts, thrombocytopenia, low red blood cell counts, anemia, low white blood cell counts, neutropenia, lymphopenia, leukopenia. Your healthcare provider may do a blood test to check your blood cell counts during your treatment and may stop your treatment if signs or symptoms of low blood cell counts happen. Potential risks from Janus kinase, JAK, inhibition. Cholesterol increase has happened in people when ruxolitinib is taken by mouth. Tell your healthcare provider if you have high cholesterol or triglycerides. Low blood sugar in people with diabetes has happened after taking JAK inhibitors by mouth. Before starting OPZELURA, tell your healthcare provider if you have an infection, are being treated for one, or have had an infection that does not go away or keeps coming back, have diabetes, chronic lung disease, HIV, or weak immune system, have TB, or have been in close contact with someone with TB, have had shingles, herpes zoster, have or have had hepatitis B or C, have lived in, or have traveled to certain parts of the country, such as the Ohio and Mississippi River valleys and the Southwest, where there is an increased chance for getting certain kinds of fungal infections. These infections may happen or become more severe if you use OPZELURA. Ask your healthcare provider if you do not know if you have lived in an area where these infections are common. Think you have an infection or have symptoms of an infection such as fever, sweating or chills, muscle aches, cough or shortness of breath, blood in your phlegm, weight loss, warm red or painful skin, or sores on your body, diarrhea or stomach pain, burning when you urinate or urinating more often than usual, feeling very tired, have ever had any type of cancer, or are a current or past smoker, have had a heart attack, other heart problems, or a stroke, have had blood clots in the veins of your legs or lungs in the past, have or have had low white or red blood cell counts, are pregnant or plan to become pregnant. It is not known if OPZELURA will harm your unborn baby. If you become exposed to OPZELURA during pregnancy, you and your healthcare provider should report exposure to Insight Corporation at 1-855-463-3463 or www.opzelura.pregnancy.insight.com. This registry is intended to collect information about the health of you and your baby. Are breastfeeding or plan to breastfeed? It is not known if OPZELURA passes into your breast milk. Do not breastfeed during treatment with OPZELURA and for about 4 weeks after the last dose. After starting OPZELURA, call your healthcare provider right away if you have any symptoms of an infection. OPZELURA can make you more likely to get infections or make worse any infections that you have. Get emergency help right away if you have any symptoms of a heart attack, blood clot, or stroke while using OPZELURA, including discomfort in the center of your chest that lasts for more than a few minutes or that goes away and comes back, severe tightness, pain, pressure, or heaviness in your chest, throat, neck, or jaw, pain or discomfort in your arms, back, neck, jaw, or stomach, shortness of breath with or without chest discomfort, breaking out in a cold sweat, nausea or vomiting, feeling lightheaded, weakness in one part or one side of your body, slurred speech, swelling, pain, or tenderness in one or both legs. Tell your healthcare provider right away if you develop or have worsening of any symptoms of low blood cell counts, such as unusual bleeding, bruising, tiredness, shortness of breath, or fever. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. The most common side effects of OPZELURA in people treated for nonsegmental vitiligo include acne at the application site, itching at the application site, common cold, nasopharyngitis, headache, urinary tract infection, redness at the application site, and fever. These are not all of the possible side effects of OPZELURA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Insight Corporation at 1-855-463-3463. Please see the full prescribing information, including boxed warning and medication guide for OPZELURA at opzelura.com.